Thank you so much, Madam Chair and Vice Chair and other members. Appreciate you coming in today because it's not the easiest day to get here. So, but this is such an important topic. We know, you probably already know that suicide rates continue to rise. We have seen a 40% increase in the past 20 years across the United States. Suicide is a 100% preventable death. As in many medical situations with suicide, prevention is the best prescription. Mental health providers suggest that patients remove potentially effective suicide tools from their home and their workplace. Anything that causes a delay in acting on suicidal thoughts can be, and frequently have been, a lifesaver. Having to pause to go get something they don't have at hand and can be enough time to help a person in crisis stop, rethink, maybe go get some help. And by the way, anyone can get help anytime, any day, by calling the suicide hotline 988. Senate Bill 539 creates a new suicide prevention tool by adding a delay in acting on suicidal thoughts. And in this bill, directly slowing things down, particularly for those who are thinking of using the most effective suicide tool, which is a firearm. Suicide attempts made using a firearm are deadly in 9 out of 10 cases. And most successful suicides are carried out with firearms. 90% of suicide attempts with firearms result in death, and an average of just 5% of all other methods succeed. 90% of firearm deaths, 5% any other kind of attempt. Any kind of delay getting access to a method of suicide can save a life. Senate Bill 539 offers individuals the opportunity to help themselves avoid the temptation of buying a firearm to use it on themselves by requesting they be added to the National Do Not Sell list for firearms. The individual can request their local police or clerk add them to a temporary or an indefinite Do Not Sell list. Names on the temporary list stay for 180 days and then are automatically removed, while names on the indefinite list remain there unless and until the individual requests their name be removed. The only way a person can be put on the list is by themselves, and they can have their name removed from either list. This is a viable and helpful tool in other states, including Washington, Delaware, and Virginia. This is not a political issue, by the way. Simply not having fast, easy access to the tool that is most effective, most deadly, for vulnerable people considering suicide saves lives. Moving the most deadly method of suicide, the one with 90% death rate, farther away, giving them time to reconsider their decision or attempt with some other method far less likely to succeed, will save lives. I urge you to help save the lives of our people, our family members, our Michigan constituents, by voting yes on 539.